Hi to everyone. I am Dr. Anna Pratap Maurya from Department of Orthodontics, Schools of Dental Sciences, Babu Banasidas University. Today I will discuss on the fixed orthodontic appliances part 1. I will include in this what are the fixed appliances and components of fixed appliances. And second part will be discussing second lecture. First of all, the fixed appliances. What are the fixed appliances? The fixed appliances are devices that are attached to the teeth by operator, which cannot be removed by the patient on his will and are capable of causing tooth movements. So there are various types of orthodontic appliances used for the treatment of malacry, which may be removable, can be removed by the patient, fixed, which cannot be removed by the patients, and orthopedic, which brings about the orthopedic changes, and myofunctional appliances, which utilize the activity of the muscles to correct the malacry. So now I am discussing about the fixed orthodontic appliances. Then what are the advantages of fixed orthodontic appliances over the removable appliances? By this, the more precise tooth control is possible, and multiple tooth movement are possible simultaneously. Patient cooperation is reduced, treatment duration is reduced, and better control over the anchors. But there are certain disadvantages of fixed orthodontic appliances, which include it is more difficult oral hygiene maintenance because these appliances cannot be removed by the patient, unlike removal appliances which are removed by the patient. Not be pleasing aesthetically because of metallic appearance, the smile is metallic. But nowadays, the various type of tooth color appliances, lingual appliances, and invisible appliances, which can reduce or minimize these problems. And for this, the special training of operator is required. It requires the uh, special training for the operator, and increased cost of treatment, increased chair side time because these appliances are put in the patient's mouth on the dental chair, unlike removal appliances which are fabricated in the lab. And patient has to visit orthodontist at regular intervals. And damaged appliance, it cannot be removed by the patients. The indications of fixed orthodontic appliances is multiple tooth movement is required. And when the malocclusion are beyond the scope of removable appliance treatment, and when there is mild to moderate skeletal discrepancy. But the contraindications, the poorly motivated patients, poor oral and dental health, because in this case, the hygiene maintenance is difficult. And severe skeletal discrepancy, it cannot be corrected by the fixed appliances. For this, we must go for the orthographic surgery and need a special training for the operator. Then components of fixed orthodontic appliances, it have two components, active components, which brings about the tooth movement, and passive components, which are used for the attaching the active components. Active components include arch wire, spring, elastic, separator, magnets. And passive components include band, bracket, buccal tube, lock pin, ligature wire, then lingual attachment. First, arch wire. Arch wire, it brings about various types of tooth movement through the medium of bracket and buccal tube. So these arch wires are engaged to the brackets and buccal tube. It provides a base to which the axillary can be attached to generate the tooth moving forces to the arch wire. These are various arch forms: square, oval, and taper. These are used according to the shape of dental arches and also the shape of a form of facial form of the patients. Then ideal requirements of the archware. The archware should have large spring back properties, low stiffness, high formability to form the loops and helix, high stored energy for the tooth movement, low surface friction to control the increase. It should be biocompatible and should be environmentally stable. And they are capable of welding and soldering to the attachment to the archwares. Then classification of orthodontic archwares. First, these archwares are classified according to the various ways. First, based on the metal used, it may be gold and gold alloys, stainless steel, nickel titanium, beta titanium, alpha titanium, titanium, niobium archware, composite or coated archware, which are aesthetics, optiflex archwares, these are also aesthetic archwares. And second, based on cross section, it may be round, like in figure A, is square, rectangular, and multi-stand. Multi-stand may be twisted and it may be coaxial. In coaxial, there is one central arch wire around which the multiple arch wires are twisted. First, gold and gold alloys. These are the first wire which are used prior to 1930s, before the advent of stainless steel arch wire. The advantage of gold and gold alloys are they have excellent formability, low modulus of elasticity, good joinability and good environmental stability, excellent biocompatibility, and strain can be increased by the heat treatment and cold. But disadvantage of these archwares are they have a low yield strength and low spring back properties, and they are costly. Second is stainless steel, which are most commonly used archwares. It was introduced by Wilkinson's in 1929. It is mainly the aesthetic form is used in the orthodontics. It may be round or rectangular. The main composition of stainless steel archware is iron 71%, chromium 18%, nickel 8%. The stainless steel are mainly found in three forms: austenitic stainless steel, martensitic stainless steel, and ferritic stainless steel. The austenitic stainless steel are used for the purpose of orthodontic wires and bands. These are most commonly used form of stainless steel. All AISI, American Iron and Steel Institute members, is the series of 300 of the austenitic stainless steel. The advantages of stainless steel arch wire are they are high stiffness, resistance, resilience, good formability, good joinability, adequate spring back properties, good biocompatibility, environmental stability, corrosion resistance, except at welded side, and these are more economic. But there are certain disadvantages of stainless steel archware. They have a lower spring back than the night wire. They have high modulus of elasticity and high load deflection as compared to night wire. Next is Australian stainless steel wires introduced by the Dr. P.R. Beck in collaboration with Mr. A.J. Wilcox. They were more tensile wire which was thin enough to distribute optimal tooth moving forces for long periods over long distances with minimum loss in the intensity of force. Since they have a low load deflection. Next wire is chrome cobalt or alloy arch wires. The properties of these wires are similar to those of stainless steel, but it is more soft and more formal. It is manufactured in four tempers: blue, which is soft and easy to bend; yellow, which is tactile; green, which is semi-resilient; and red, which is resilient. So most common used form is blue, and green, which are used in the initial alignment and leveling stage. The main composition from cobalt arch varies: cobalt 40% and chromium 20%. The advantage of alloy are they are excellent tarnish and corrosion resistant. They have a greater resistance to fatigue than stainless steel, greater resistance to distortion. They have good formability, low load deflection rate. It can be soldered and welded. The disadvantage is that it has to be heat treated prior to use, and the modulus of elasticity is high. Next wire is nickel titanium or nitinol arch wire. So name nitinol is an acronym. It is derived from the elements which comprise the alloy, that is nickel and titanium. And the name is based on a novel furnace laboratory. The nickel titanium arch wire have the excellent spring back properties. And nitinol is basically of two types: thermal nitinol and elastic nitinol. The main composition is nickel and titanium. The thermal nitide, it shows shape memory in the martensitic phase, and wires with austenitic finish less than 37 degrees centigrade exhibit superelasticity. Where elastic nitide, these are also used in the martensitic phase, and it maintains its high elasticity and flexibility. And it exhibits the desirable property of lighter continuous force of deformation. The advantages: they have high spring back and elasticity, they have high stored energy, they have low load deflection rate, but they have certain disadvantages, which are high friction as compared to the stainless steel. So these wires cannot be used during space closure in sliding mechanism. They have low stiffness and formability. We cannot make spring helix and loops in stainless steel arch wire, and we cannot weld or solder. These are also expensive as compared to the stainless steel arch wire. Next is copper nitride. The copper nitride arch wire, it was developed by Dr. Rohit Sachdev and Miyazaki in 1994. So addition to copper, it decreases the difference between loading and unloading of forces, causing delivery of more constant force for the small activation. Addition of copper also increases surface smoothness. So they have a less friction. Copper content also play an important role in controlling the transformation temperature of the alloy. The main composition is nickel and titanium. There are four types of copper nitride wires. Type 1, which are active at 15 degrees centigrade, but it is not used clinically. because mouth temperature cannot reach at 15 degrees centigrade. It exerts very high forces. Second is type 2, which are active at 27 degrees centigrade. So these are normally used in the patient with average pain tolerance, and periodontium should be healthy. So they produce a constant force. Type 3 at 35 degrees centigrade. These are most commonly used carbonatite archware. These are used in the patient with low pain threshold value. They are normal to slight compromise periodontium, used only when low forces are desired. Type 4, which are active at 40 degrees centigrade. Used in the patients with low pain threshold value, where tooth movement is to be slow and intermittent force is generated, because when the patient takes hot drinks, hot food, hot beverages, then these wires are only active. So it apply an intermittent force. They are used as initial alignment archware. Advantages of Capernatic archware: they are more resistant to permanent deformation, better spring back as compared to the other nitrile alloy. Their more constant forces are exerted over small activities. Next, beta titanium are TMA archware. So the process of iron implantation for the surface treatment of these wires decreases the friction, because titanium, beta titanium archware are more rough, so they have a more friction. These are usually patients which are allergic to nickel because of absence of nickel in beta titanium archware. So these are ideal for the situation where forces are less than the stainless steel and more than the nitrile alloy are required. So the main composition is titanium and volume. Next advantage of these wires are they have high spring back and formability. They have low modulus of elasticity, low load reflection rate and stiffness. They have more environmental stability. They have excellent corrosion resistance and can be joined by electrical resistance well. But they have certain disadvantages. They are more resistant to permanent deformation, more friction as compared to the stainless steel, and they become brittle on overhead. Next, titanium or niobium alloy, introduced by the Roy Sachdeva in 1995. They have less stiffness as compared to the TMA wires, resulting in an increase in formability of the wires. They have a low deflection rate is same as TMA wires. These arch wires are ideal as fencing wires due to high formability and low deflection rate. So canine to canine fixed retainers are also made by these titanium niobium alloy wires. Next, multi-standard arch wires. They are classified according to cross section. It may be round or rectangle. Number of constituents, it may be 3 strands or maybe 6 strands. And mode of joining of these constituent strands, it may be braided or it may be twisted. Coaxial arch wires made of central core wire of 0.006 inch diameter wire with 4 or 5 outer wire. These are central wire and these are the outer wire. So these wires are more flexible and used for the initial alignment of the tip before the advent of nitrile. Next, composite coated wires. These are static wires. So these are made of combination of materials coated on the top of another. The coating fibers include fiberglass and iron. The resin include polycarbonate and polyethylene terephthalate glycol. So for each fiber resin system, there is a heating or working range where the material can be formed or shaped without any degradation in its properties. Next, Optiflux arch wire. These are also tooth colored arch wire, aesthetic arch wire. They are composed of silicon dioxide core, which provides the force RA resiliency to the arch wire. The silicon resins form the middle layer. So this aids stain to the wires and also protect the core from moisture. The nylon outer layer makes the wire stain resistant and also prevents it from damage. So these are available in round and rectangular cross section, and they are the tooth colored arch wires. These wires provide light continuous force. Next, bracket. So bracket is passive component of the fixed orthodontic appliance. So these brackets, they act as a handle to transmit the force from the active component to the tip. So they have a one or more slots, vertical and horizontal, that accept the arch wire. Like this first and second figure, they have a horizontal slot. And third figure, they have a vertical slot. Classification of brackets, these are based on the various ways, like types of slot. It may be ribbon, arch brackets, or base arch brackets, edge-wise brackets, which have horizontal slots. Mode of attachments, it can be weldable and it can be bondable to the tooth, directly to the tooth. In weldable, we can weld these brackets to the bands, then cement. And materials used in the manufacture, it will be metallic brackets, ceramic brackets, plastic brackets, polycarbonate brackets, fiberglass reinforced plastic brackets, polyurethane brackets, and titanium brackets. So according to morphology of brackets, it may be Siamese brackets, mini twin brackets, single wing brackets, self-ligating brackets. According to the slot, O22 into O28 slots, O18 into O25 slots, and O22 into O230 slots. According to the techniques for use, edge-wise appliance, paid slide wire appliance, straight wire appliance, tip edge appliance, lingual pre-addition edge-wise appliance. First, edge-wise brackets used in the edge-wise techniques are straight wire, pre-adjusted techniques. They have a horizontal slot. They are facing labeling. They accept a rectangular cross-section wire, the larger dimension being horizontal. It brings about the three-dimensional control of the tooth. Second is ribbon arch and base brackets. They have a vertical slot. If facing occlusally in the case of ribbon arch and facing gingivally in the case of base technique. They accept ribbon arch or round cross section in base technique. It brings about tipping type of movement. Then bondable brackets, they are bonded directly over the enamel using Bondi adhesive after surface treatment by 37% phosphoric acid of the enamel. The undersurface of brackets have a mesh, but or they have grooves to help in interlocking with the adhesives. Welded or soldered over the bands in the case of weldable brackets. So first we weld or solder the band of these brackets over the bands, then the bands will be cemented to the tooth. They have a metal flanges, they have are extension of metals that can be welded to the bands. And metallic brackets, stainless steel brackets, they are more commonly used brackets. They exhibit advantage of these metallic brackets are they exhibit least friction at wire bracket interface. They can be sterilized and recycling. They resist deformation and fractures. They are cost effective. But the disadvantage of metallic brackets, they are aesthetically not, they show a metallic appearance. The patient tends to have a metallic smile. They can corrode and they cause staining of the teeth. Next, ceramic brackets. These are aesthetic brackets or tooth color brackets introduced to orthodontists in late 1980s. They are made up of aluminum oxide or made up of zirconium oxide. The advantage of these brackets are they are aesthetically pleasing, they are dimensionally stable, and they resist staining oral cavity, and they are resistant to tarnish and corrosion. But the disadvantage are they are brittle, therefore fracture when undue forces are applied, and they exhibit greater friction at wire interface brackets, and also they are more bulky. Then plastic brackets, these are made up of polycarbonate or a modified form of polycarbonate. They are available in tooth colored or in transparent form. The advantage of these brackets are they are improve the aesthetic value of appliance. But the disadvantage, they have a poor dimensional stability and their slots tend to be distorted by use of heavy wires, and they exhibit very high friction at wire bracket interface. So there is chances of loss of anchorage, and they tend to discolor, particularly in patients who smokes or drink coffee. Then fiberglass reinforced brackets. These are basically polycarbonate reinforced fiberglass. Fibers are about 2 to 3 millimeter in length and 0.8 millimeter in diameter. So plastic conditioners is methyl methacrylate monomer to dissolve the polycarbonate based to enhance adhesion with the adhesive. Next component is buccal tube, which is also the basic component of fixed appliance. So they have horizontal hollow tube. It may be round, rectangular, or oval in shape. So these are used on the molars and help to provide better three-dimensional control of these teeth. The classification of buccal tube, first based on the mode of attachment, like brackets, it may be weldable, means welded onto the bends, like weldable. Bondable, means directly bonded to the tooth surface. It may be, the lumen may be round, oval, and rectangle. It may be also classified according to the number of tubes. It may be single tube, double tube, and triple tube. In triple tube, there are two rectangular slots and one for the headgears. The based on techniques used, it may be edge-wise tubes, back tube, and pre-adjusted edge-wise tube. Next component is lingual attachment. So lingual attachment, these are accessory attachments other than the brackets and tubes, which are placed on the lingual aspect of the tube. It may be bondable or weldable. Lingual buttons first available in various shapes according to the tooth to which it should be attached. It required for engaging elastics and each. Next is lingual seating legs. It helps in seating up the bends. Lingual cleats used to tie elastic threads are ligature wires. They have a hollow in middle and welded on the two sides. Lingual cleats used to tie threads are ligature wires, welded in the middles and ends being open. Next is lingual elastic lugs used for attaching elastics. Next, lingual balls. These are small balls attached to a weldable flat arms used for attaching elastics and each end. The lingual sheath used for attaching accessories such as transpalatal arch, nickel titanium molar, rotators or extenders. So these are used on the lingual surface of molars. Next is lock pins. These are used in the back techniques to hold the arch wires in the bracket slots. These are the lock pins. They are also used as accessories in tip stacking and made of brass wire or soft steel. In ligature wires, these are made up of soft stainless steel wire of 0.008 inch to 0.010 inch in diameter. They are used to hold and ligate the arch wire in brackets or to tie segments on the teeth to each other. Next, bands. Band is also personal components. They are cemented to the individual tooth, and auxiliaries can be welded or soldered to the bands. Bands can be preformed or they are custom fabricated for the individual tooth, which are available in spool forms. Banding steps in banding. First, the separation of tooth by use of the separators, then selection of band materials according to the tooth, and these bands were first pins, then adapted bands around the teeth, and then pins with the pliers. Then pitch bands is removed and welded. To close the pinch ends, an extra band material is cut off and bent and then again welded. And then margins are smooth and gingival contouring were done. Then fixing of attachments by welding or soldering to the band. And then final cementation of bands. Steps in bonding. First, cleaning is done using water slurry, a pumice with a rubber cup, a polishing brush, and moisture control is achieved by using cheek detectors, tongue detectors, in conjunction with cotton rolls and saliva ejectors. And enamel conditioning is done using 37% phosphoric acid. And edge surface wash, dried to white frosty appearance. Then the sealing agents, which is called primer, is applied over the entire edge enamel surface using a brush with a single gingival incised stroke. Then a coat of sealant is applied on the bracket base and composite is sprayed on the bracket display. Then bracket is placed under the pressure onto the tooth surface on the desired position. Then excess flesh is removed with the help of a scaler. And then these are the light core. In the case of light core composite or in self cure, we leave for some time according to the manufacturer's instructions. The advantage of bonding over the banding. The bonded attachments are aesthetically superior. It is faster and simpler. Bonding is more comfortable for the patients because there is no need of separator placement and band placement, banding process, because banding process causes trauma to the soft tissues. More precise bracket placement is done on the tooth surface. Oral hygiene procedures can be performed more easily in the case of bonding. And proximal stripping can be performed because the proximal surface is free. But in case of bending, these proximal surfaces are covered by the bands. So the composite buildup can be done on interproximal areas. So inventory is reduced as various band size do not need, and there is no need of spot welders for welding. And no band spaces is left after debonding because the thickness of band. And caries or hypocalcification is less in bonding as compared to the bending. The disadvantage of bonding over the bending. A bonded attachment is weaker as compared to the cemented band. And rebonding is more complex as compared to the re-cementation of the band. Because in rebonding, we need to remove the composite, then enamel conditioning, then sealing, application of sealing materials, then light coat. But in case of bonding, only we cement the bands. Bonding on the lingual aspect can be difficult at some times because of the because inaccessibility of that area. And bonding might not provide insufficient strength when headgears and auxiliaries exert large forces are used. So in these cases, we prefer to use band. Thank you. The next part will be continued in fixed orthodontic appliances part 2. For rest of the my lectures of fixed orthodontic appliance, you can see on part 2. Thank you.